Hello, my name is Jasmine, and this is my infomercial on COVID-19. What is the coronavirus? Coronaviruses are a large family of viruses that cause illness in animals and humans. In humans, several coronaviruses are known to cause respiratory infections, such as the Middle East Respiratory Syndrome, known as MERS, and the Severe Acute Respiratory Syndrome, known as SARS. So what is COVID-19? COVID-19 is the infectious disease that's caused by the most recently discovered coronavirus. And so this new virus and the disease were unknown before the outbreak began in Wuhan, China in December 2019. COVID-19 in the United States. According to the CDC, the first ever reported case of COVID-19 in the US was on January 22, 2020. The following data was taken on April 21, 2020. The total amount of US cases would be 776,093. The total amount of US deaths would be 41,758. And the state with the most COVID-19 cases in the United States is New York with 245,580. California currently has 30,978 COVID-19 cases. Here I have a weekly summary chart of US COVID-19 hospitalizations, and they are based per 100,000 people. So as you can see, week 10, everything was merely at 0. And 5 weeks later, at week 15, we are now at April 11th, 2020, and the average hospitalizations per 100,000 people have increased dramatically. So that's very interesting to see as it is separated in age groups. Severe Acute Respiratory Syndrome, also known as SARS. So SARS was first reported in Asia in February of 2003, and there have not been any more known cases of SARS reported anywhere in the world since 2004. SARS quickly spread to 26 countries before being contained after about 4 months. The 2003 SARS outbreak was considered to be an epidemic, and research evidence suggests that SARS, MERS, and COVID-19 may have originated from bats. However, bats are capable of transmitting the disease to other animals such as camels, civet cats, and the pangolin. And those animals then transmit the disease to humans, which are known as the final host. Middle East Respiratory Syndrome, also known as MERS. MERS was first reported in Saudi Arabia in September of 2012 and has since spread to 27 countries. From its emergence up until January 2020, the World Health Organization confirmed that there were 2,519 cases and 866 deaths. Now, only 2 people in the United States have tested positive for MERS. However, they have both now recovered. Now, research has shown that MERS was first transmitted to humans through camels, and that is what this photo is showing right here. COVID-19 symptoms. There are a few COVID-19 symptoms, but some of the most common ones are fever, tiredness, dry cough, sore throat, and a more newly discovered symptom is the loss of taste or smell. A more serious symptom that requires medical attention would be difficulty breathing, shortness of breath, any pain or pressure in the chest, confusion, or any bluish tints to your lips or face. COVID-19 risk factors. There are 2 groups of people who are at high risk for contracting COVID-19, one being older people because of their age, and 2 being people with pre-existing medical conditions. Some of those conditions being high blood pressure, heart disease, lung disease, cancer, and diabetes. How is COVID-19 spread? COVID-19 is spread through person-to-person contact. So when someone sneezes or coughs, small droplets are expelled through the mouth and nose. So when someone inhales or breathes the small droplets from an infected person, there is a possible chance that they will contract the disease. You can also get the disease by touching any infected objects and then touching anything on your face, such as your mouth, nose, or eyes. And COVID-19 is not airborne, so when the droplets are expelled, they fall straight to the floor because they're too heavy to remain in the air. COVID-19 treatment. There's currently no vaccine or specific medicine to treat COVID-19. However, there are clinical trials that are undergoing for vaccines and medications that can help treat COVID-19. How do I protect myself from COVID-19? Wearing a face mask and gloves when going out in public can help. Regularly washing your hands with soap and water for at least 20 seconds, or using hand sanitizer if neither of those are available to you. Avoid touching any areas in your face. Cover your mouth and nose when coughing or sneezing. Remaining in a 6-foot distance from people and staying at home as much as possible. What to do if you're sick with COVID-19? Some things you can do is staying home, except when you need medical care, separating yourself from anyone in your household, including pets, monitoring your symptoms, wearing a mask over your mouth and nose, cleaning your hands regularly, and cleaning all surfaces on a daily basis. How to care for someone who has COVID-19 at home? You can limit contact, eat in separate rooms, avoid sharing any items whatsoever, wear a mask and gloves, and track your own health to make sure that you don't contract the disease. If you or anyone you know would like to seek for more information on the coronavirus, you can go on the CDC website, the World Health Organization website, or www.coronavirus.gov. And a more local resource would be Everyone Home Long Beach, and they have a really good multi-service center there for anyone who is in need. And that concludes my presentation. Here are my references. Thank you.